This May on Health Digest, we have been looking at cancer diagnosis, treatment and management. And so far we have looked at the diagnosis of cancer, we've looked at radiotherapy, and today we look at chemotherapy. What are the options for chemotherapy? What is chemotherapy? And I sat down with doctors, oncologists who manage cancer with chemotherapy, with some of the pharmaceutical technologists who are involved as part and parcel of this provision of treatment. And obviously the patients who are undergoing chemotherapy, their experiences and what they've learned through this process. And we start off with the patient's story on what their experience on chemotherapy has been. Chemotherapy is a category of cancer treatment that uses one or more anti-cancer drugs. Chemo, as is popularly known, may be given to cure the cancer, to prolong life, or to relieve symptoms, that is, palliative care.
My name is Samuel Kimiti, aged 49 years.
When were you diagnosed and which diagnosis?
September 2017, last year. According to the medical language, it is the head of the esophagus. They see that I don't know, gastric something, yeah.
I'm Elizabeth Omaitha, I'm 24. I was diagnosed in 2016. And then I underwent chemo. And in 2017, around December, it recurred again. Around November, December, it recurred again. Colon cancer. Then 2017, it recurred again. So again, I started treatment. And then I was told colon cancer had gone. And I'm doing chemo for stomach cancer. Yeah.
When you were told of the diagnosis, then how did you feel?
I felt sad, of course. Definitely you feel bad, but then you just accept because I'd been in hospital for a long time. So I was like, okay, it's okay, whatever comes. I'll just have to get treatment, get well, and just move on with life.
As a matter of fact, I was somehow withdrawn. And maybe I say according to history, it is only related with death, so I could see my death. But later, after attending some therapies, I was told it is not the end of life, and I made it part of me.
When you were told of the diagnosis, what was the treatment plan that the doctors had told you would undergo?
But before that, I'd done surgery. So after surgery, that's when they found out I had cancer. So I was to start chemotherapy. Yeah, so they did chemotherapy. And then again, I got well, did my CT scans. They saw that it's gone in the colon. It was not there. But now again, I found out that it was back. So I started chemotherapy again.
The only thing they said is that they are going to put me under chemotherapy, and I started immediately. Yeah.
We'll use this vein to draw blood. Then we do the test. If the results are within the normal ranges, we proceed with chemotherapy. Is that okay?
Very much okay.
Okay.
So, is it routine to do this blood test before the chemotherapy?
Yes, these are routine blood tests. We normally do them before we start chemo to make sure that, because chemo normally suppresses the bone marrow. So you want to check that everything is okay and the patient is fit for chemo. So it's a routine procedure. We know mainly we check the full hemogram and the kidney function test.
Continue.
Which one are you doing now?
No, this is for the kidneys, the kidney function test. Mainly we are concerned about the creatinine levels. And this one is the full hemogram one. We check the hemoglobin levels, the white blood cells, and the platelets mainly. Yeah. So the test, like the full hemogram, will take about 5 minutes. So in the next 5 minutes, we'll know if we'll proceed with chemo or not. Yes, and we hope we'll proceed. We hope the results will be within the normal ranges. Yeah.
So what's the work of a chemo infusion nurse?
A chemo infusion nurse basically oversees the administration of chemotherapy. The first things we'll triage the patient to make sure vitally they're okay and their performance is okay, performance status, and they're ready for chemotherapy. Then from there we come to the lab, draw the blood samples, wait for the results for about 10 minutes. If the results are within the normal ranges, we give the pharmacist the go-ahead to start preparing the drugs. So the pharmacist prepares the drugs, labeling them with the patient's details. And once they are ready, I pick the drugs and now we start the infusion process. Yes, which varies depending on the regimen the patient is on. Yes, some can take 30 minutes, others 1 hour, 2 hours, others 3 hours.
At what point do you decide to give chemotherapy?
So there are various instances in which we give chemotherapy. The first and the foremost is in the setting of where you want to cure somebody of their cancer, assuming they've had surgery, let's say for breast cancer, and we know that adding chemotherapy on top of the surgery has a better outcome associated with that. There are other instances we give chemotherapy to palliate patients' symptoms. Patients who have advanced cancer doesn't necessarily mean that they have to die, but we can give them chemotherapy to take their symptoms away and improve their quality of life. So 2 main reasons, mainly either to cure your cancer, or if we cannot cure your cancer, to improve the quality of your life.
So in this whole process of giving chemotherapy, who are the people that are most critical, or which specialists are needed in this whole process of giving chemotherapy?
Obviously, you need your doctor, your oncologist, be it a medical oncologist or a clinical oncologist, somebody who understands chemotherapy and can prescribe the correct treatment. You need your chemotherapy nurse, who is very crucial in terms of preparation, counseling, going through the consent process, side effects, and just being with the patient through the process. You need your pharmacy team, the technicians, the pharmacists, to mix the drugs, reconstitute them, make sure the dose is correct, make sure they have not expired, making sure that the combinations are correct, because sometimes the doctor's prescription can have a mistake which has to be picked out by pharmacy so that patients don't suffer from side effects. You need your nutrition team. They're very important. A lot of cancer patients struggle with eating and diet and poor appetite, so you need nutrition to be on board. You need your psychology team to be on board, the nurses, the palliative care nurses, to talk to these patients, because patients have a lot of anxiety, especially when they are starting their treatment. So they need this whole team to be with them. And it's a big team, including even the people doing cleaning inside the chemotherapy area, the people who are providing food and nutrition, the people in management. So it's a big team, because if for example, you're coming for chemo and you have to battle with, an insurance process or maybe an NHIF or something, even the people in the front desk, they make your life easier by taking you through the claims process and, the payment, so that the whole experience becomes something that you would not mind, going through again.
And how do you give this chemotherapy? Are there ways of giving chemotherapy drugs?
In different forms and formulations. There are those that are given through the drip, and there are those that are given through tablets. They serve different purposes, and there are over 60 different types of chemotherapies that we use. Each cancer has its own specific treatment, and even within the same cancer, you might find that your treatments are differing between one patient and the other. So dependent on your stage, maybe other diseases that you have, your state of physical health in the body, you know, maybe if you have kidney disease, we can use a different type of chemotherapy compared to somebody else. So there are very different things we consider when we decide which chemotherapy we're going to give the patient.
We have a patient by name Samuel. So first what we do with such patients, tunapata all the blood works from the lab, confirm the WBC, HB and whatever. We find them they are correct for the patient to get a chemo. First what we do for the patient, tunampea kitu inaitwa pre-meds. So the pre-medications, most of them they are common. We use dexamethasone, ranitidine.
What does the dexamethasone do?
Dexamethasone is steroid. It is mostly for allergic reactions. Yeah, ranitidine is an antacid, simple language. Yeah. And then we have something called Ondem, but here we are using what we call granisantrem. It is in the same group.
Generally, what are the pre-meds supposed to help the patient with?
Generally, with chemotherapy drugs, they have a lot of side effects when administering them. That's why you have to dilute them. The pre-meds, they are used to mostly for prophylaxis purposes. You can find a patient reacting to a certain medication, mostly the skin rashes. Some of them may have GIT side effects.
To like preempt the side effects and be able to take care of the side effects should they occur during the process of chemotherapy.
Yeah, it's just like a precaution.
So that's Clasil antiemetic. So
This
that
is
they don't
for nausea and vomiting. Yeah, and then after the pre-meds, what we get next is the main drug. Now this is the chemotherapy part of it. What we are going to use for this patient is oxaliplatin. Oxaliplatin 215 milligrams. And it is going to be mixed in dextrose, a half a liter. And it should run for not less than 2 hours. Yeah. This is dextrose, not less than 2 hours. After that, after I've written this, now every patient who gets a chemo, we must do what we call flushing. So we will use mostly normal saline.
What is the purpose of the flush?
The purpose of the flush is the same thing that we use during pre-meds, but you find that most of the chemotherapy, they are mostly cytotoxic. So we remove them from the veins using the normal saline.
So why do you have to chart this on the board here?
We have to chart them so that we don't make a mistake, mostly with the chemo patients. It is a very strict thing, mostly. And then the reason why we have to chart is for confirmation purposes. You see, we are going in bits. Like, for example, we have to do pre-meds. We wait until it goes all. Then we have to do this, then this. So it's a process. Now, you can't tell me you only use this for confirmation purposes. Yeah. Then after that, what I'll do next is prepare the pre-meds. Let me start with Grand Central. This is the Kyltril. And this is the ranitidine. It is called a H2 blocker. Then we have the placebo for emesis. Then we have the dexamethasone, which is the steroid for allergy. So these are the main 4 we are using for oxaliplatin. But some of them you'll find that we use, we can add piriton or pantocid or such like this. Now this is 250 milliliters. We want to prepare the so-called pre-meds. Now, this is these are the pre-meds now. What I'll do, I'll indicate the name of the patient, also for the confirmation purposes. So he's called Samuel Kimeti. We indicate it as pre-meds. After this phase, I'll give the nurse the pre-meds to start running it as he waits for the main drug. Yeah.
So as this runs, do you start preparing the main drug, or do you wait for it to finish, then prepare the drug?
It will run for about 30 minutes, I'll estimate. But there is no big deal preparing it immediately or not. This is the pre-meds. I'm starting the patient on what we call the pre-medication before the main chemotherapy. I expect this 250 ml pre-meds to run for about 30 minutes.
Digest takes a break, and when we come back, we'll continue with this discussion on chemotherapy for cancer treatment and management.